nice cheekbone, which gives strength and kind of angular, model-esque cheekbone. And you are a beauty editor, so you must have some favorite models. Who are your favorite models?
Linda Evangelista, probably back in the day.
Love her, yes, and Paulina Porsakova.
Oh my God, yeah, she's
Loved
great.
her,
Still
too.
great.
Yeah, she's still great. She's writing a lot of interesting things about aging as she changes in her face from her modeling years, and she's being very naturalistic, but she's still doing a few things.
Mm-hmm.
Yeah. Any major things that have affected you in terms of once you turned 50? What did you notice in your skin and your collagen?
Well, it's just the menopause is really just brutal. I feel like it's not until you start going through that you really start to see, because it was rapid after like 45.
It's funny, it does seem to be very like a significant sudden turn of the corner.
Mm-hmm.
Not a real gradual thing.
Mm-mm.
So I think that people who do a little more maintenance regularly will benefit from not suddenly hitting the wall. I always tell my patients the things that you do every day, like really great skincare, are going to keep you young, and seeing me like once or twice a year that's actually the way to go. And it really, taking care of your face really ought to be like getting an annual physical. I just think like facial identity is so important, like psychologically who we are. It's what we project, what we see in the mirror. It affects our mental status, makes you want to either stay in bed or go out and be amazing. So you got to put forth the effort a little bit. Okay, so look at that gorgeous bone structure that we've just created. I want to build a cheekbone that's going to look like her own natural ones. And I don't know you from when you were 30, but I can tell from your facial anatomy that you had these model cheekbones when you were younger, and they're still here. Everything I placed is right on your bone structure. While it looks a little swollen, and that is very normal because we're poking it with a fresh needle right this minute, all that goes down in about 4 to 7 days, and 10 to 14 days, everything settles just right. So slight swelling is very normal, but what I want you to appreciate is this lift, contour, support. It's a slimming and sculpting technique. Now we're going to do the same thing with the jawline to tighten this little bit of excess skin and tighten backwards. Okay, great. You can turn to that side. And can I get a marking pencil? How has the sensitivity been so far?
Oh, it's fine. I mean, I know I know my face is gonna look like a bee stung it a bunch of times, but because that's my face. But so far, the discomfort has not been bad at all.
Good, not that bad. We used a nice numbing cream for at least about half an hour to get things nice and numb. I'm marking her angle of her mandible. We can see that we age in a couple spots on the mandible here at the antegonial notch where there's a little indent of hollow where the bone just has that natural notching. And in here, this is called your pre-jowl sulcus. So there's 2 spots where as I do her jawline, I'm going to try and improve. Not going to touch the jowl area because we don't want thickening in here. But the goal is to pull things backwards. And here I'm using a collagen stimulator. This is Hyperdilute Radius. It's a product that helps to grow collagen, and it also has some immediate benefit. We'll be able to see lift, tightening, and pulling things gravitationally back where they belong. So it has the benefit of both worlds, and I'm a big fan of collagen stimulators versus gel fillers. So I use a ton of filler in my practice. I worry that people on the gram are worried about filler face and filler fear. It's unnecessary to have filler fear. When filler is placed properly, it becomes like a facial fat substitute. But you have to see a good injector. The reason people fear filler is because everyone has cheaped out and gone to places where undertrained people who have degrees, admittedly, like they might be an RN or they might be an NP, but perhaps they don't have surgical anatomy training. And so placement of filler is critical. I'm going to use gel fillers wherever we need soft tissue replacement. So that's going to be like for her under eye. She's already born with fabulous. These are natural lips. And we'll use those in perhaps the nasolabial folds. We'll definitely use some of that in the temples. But there's a use case for facial fillers. So do not fear the filler. And but also by the same token, don't fear the collagen biostimulators, because these products that grow collagen, there's a lot of talk online about once you use collagen stimulators, you can't have a facelift. If you use Sculptra or Radius, you can't have a facelift. That is not correct. A surgeon should be able to operate in the setting of these products, number one. Number two, when we inject in the proper plane, we're not going to interrupt the dissection plane of surgery. So yeah, if you've seen a bad injector and you've had bad work done, it's perhaps your facelift will be a little more difficult to dissect. That does not mean it's not possible. And I think it's very masculine thinking to think that I'm going to do nothing for like 20 years until I have the inclination and then just get a facelift. That's not what I want my patients to do. I want them to feel comfortable to do the maintenance until you're psychologically really ready to do a facelift, because that's a big deal to do something. So I think, Jennifer, you and I were on the same page with that thinking, right?
Mm-hmm.
Yeah. Your thoughts on that?
I felt like I just want to do minor things, and I'd rather not do anything drastic. I'd like to do minor things
You can have
regularly.
prettier eyes too.
Regularly.
Show us those pretty eyes.
I'd like to do minor things fairly regularly.
Yeah.
That's sort of been my, and I didn't for a couple of years, and I really could see how much my skin needed it.
Yeah, baby steps.
Mm-hmm.
And I think that, it terrifies people to do big major leaps. Like, I'm gonna go from doing nothing,
Yeah.
and then I'm gonna go right to surgery. Like, that's not realistic, and I don't want a woman to have to do that. I think this type of a treatment where we bolstered heaviness backwards and took the weight off of the eyes by putting the cheeks where they belong, took the jowling and lifted it. Like, take a look. It looks like a non-surgical facelift, basically.
Oh my God! Wow.
Yeah.
Wow. You just added so much structure to my face. That's crazy.
Beautiful.
That's crazy.
It's really great. And then, so this is our first step, pulling things up and
Mm-hmm.
back. Our second step, we're going to come in and do some chin projection, because your chin is still under projected. When the chin goes in, we feel a little droopy like that. So I want to bring her chin forward. We are going to work on her tear troughs. She's definitely a candidate for eyelid surgery if she wants to. But again, it's always an interesting idea to do something non-surgical first, because I think with a little touch of tear trough filler, we can actually soften that quite a bit. If it's precisely placed and placed deep, it's going to look great. And then we're going to come back and do some temple filler, and you guys will be shocked to know that the temple is probably the most important part of this equation. The cheek and the temple, I think, are where we can get the home run. So kind of a 3-step beauty plan. I like that idea, like first base, second base, third base, and then the home run, right?
Amazing.
Amazing. All right, guys, that's it for now. If you're an injector, find me at Modern Aesthetic Theory and Artistry, and that's on Instagram and our regular Instagram, Beauty by Dr. K. And stay tuned, because we're going to show Jennifer's journey as an amazing, strong, confident, educated woman who's taking care of herself.